Medicare is testing a new way to cover medical transport for people who have ongoing treatment, especially dialysis. But patients and ambulance drivers say the pilot program is making it tougher for people to get to the doctor. Investigative reporter Chris Horne has a preview of his special report, Uncovered Medical Transport Troubles.
Several times a week, Gladys Goodhope needs a ride to her dialysis treatments. She has several medical conditions and says she's too frail to walk or even ride in a wheelchair.
I'm afraid I'm going to fall because the way that it's a certain way I turn, the hip will give out.
But the past few months have been a hassle for Gladys. Medicare is testing a new process for reimbursing the cost of her ongoing ambulance trips.
I don't want her to be worried about how I'm going to get back and forth with the doctor. I don't have the money.
Her doctor sent in the new paperwork, but Gladys is still waiting for approval. She's had to come out of pocket for several trips. Ambulance companies can transport patients and hope that reimbursement comes through, but some say they can't afford to wait.
We've had to drop a bunch of patients that we were normally taking.
Medicare says the idea is to reduce costs and fraud, and that no new paperwork is required. But this ambulance company owner says he ends up having to help patients track down their medical records for approval.
Because it's a new policy, facilities and nurses and nursing homes are kind of hesitant to release all these records and documentation.
We ask Medicare what happens to people such as Gladys Goodhope who fall through the cracks and have to pay out of pocket and find a new ambulance company. We also want to see proof that the pilot program is in fact saving money and cutting fraud. Chris Horne, 10 on your side.
Now see this 10 on your side investigation tonight at 6 with coverage beginning at 4.